Welcome to the wonderful world of wellness with Dr. Andy MENCIA. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy MENCIA. Okay, I guess we're here, aren't we?
Good morning, we are here.
We are here. We've been having our own private radio show.
Richard doing flips in there.
Yeah, right. Well, we've been having our own private radio show off the air, you know. And now all of a sudden we have to share our stuff. Dr. MENCIA has really brought up a very good question, a very good topic, because I've been concerned about the flu. I'm hearing all these terrible things going on out there.
Well, you know, the first thing we need to bring out there to our audience is that the worst is not over. You know, this is only the middle or the beginning of January, so the worst is yet to come. So.
And the weather's been warm.
And the weather, well, it's changing, which is worse. You know, if you notice it, you know, you have that cold front that went to the east, or the rain, and now it's getting warm, and then it get cold again, and the change of temperature, the abrupt change of temperature doesn't make it any better. So the environment is really not helping, and the fact that this flu season is one of the worst we have seen now over 15 years, you know, with the number of deaths that we have and everything. So it's getting, the record keep climbing. Last week, we say it was the worst season in the past 10 years, remember?
Yeah.
The reality is getting, you know, the numbers are climbing, so the flu season that we are going through, 2012, 2013, is going to be a record breaker, likely. So, what to do?
Well, Dr. MENCIA is open on Saturdays.
We are open on Saturday. we are open on Saturday. You can. We have plenty of flu right now. We are happy to say that we still have plenty of flu to provide to our patients and family. So if you have a family member that need to get injected, that need to get checked. If you cannot make it to my office, you can make it to another doctor's office. Go there, get checked. I have one patient that went to a pharmacy. They were about to give the patient the flu shot, and the wife sitting with the patient, and he listened to the show. So he heard the show last week. He went to get a flu shot, and the wife sitting there, and they are there ready, you know, already putting the alcohol pad, just cleaning him up, ready to inject. And the wife say, "Well, why is he sweating?" And the technician say, "I think he's nervous." And he say, "I'm not nervous." She goes, "Can we check his temperature?"
The wife said.
The wife said,
"Great.
Before you give him the shot." And it was 102 point something.
For an adult?
Yeah.
Oh, my gosh.
So she said, "We better go and see the doctor. They'll give him the flu." And she was right.
See, and we talked about that.
You never want to get the flu shot. Is not a treatment for the flu. That's your take-home message. It's to prevent. You have to make sure that you are okay. And when you go to the doctor and they check you and they make sure you don't have any sinus infection, make sure your throat is okay, and then you get the injection, you are more likely to respond in a positive way. And you hear so many horror stories out there on people that got the flu shot, and this is one of the reasons. This guy would have been one of those horror stories. He would have said, "I got the flu shot and I died," or "I got the flu shot and I developed pneumonia." No, you were in the process of developing the pneumonia. You know, and he was so bad, we put him on 2 antibiotics, not 1.
No, I know we talked about this at the early part of the, I don't know, we started this in I think in November, and I got my flu shot right away. My husband always gets his, and of course Dr. MENCIA got his and his family, and I just feel so protected because I did have some friends recently where they got sick, and they really got very sick, and it affects their bronchial area. They wind up in the hospital. Yeah.
And the thing is also, if you have any major chronic conditions such as diabetes, hypertension, coronary arterial disease, you see a lot of visit now, people going to the emergency room with TIA, and it's been induced by the flu. Because if you have previous TIA, any coronary arterial condition, you can be getting chest pain, you can be getting some shortness of breath. I saw a patient this week that came to me with shortness of breath, and it was being induced by the flu. When he was a kid, he used to be asthmatic, and then he outgrew, quote unquote, and he'd been doing fine. But now he's getting this shortness of breath, so we are, treating him to allow him to continue to work and be productive and stay with his family and what have you. And next week he's going to come back, and lo and behold, if he's doing well, then we'll go ahead and do the flu shot because he is late. So there's a lot of story that you hear on the news, all over the news. When you hear all over the new media talking to you about a topic, try to take it seriously. It's a lot going on. And then who's at risk of complication from the flu? The two extremes of age, the very young and the very old. So if you are in your 90s, you are at very high risk. If you are in your 80s, you're still at risk. If you are in your 70s, you are at risk, but a little bit less. So don't play with the roulette. And, if you know that you should get vaccinated, please go and get checked and get vaccinated. I've been working with, senior helpers that are checking on their patients, and other agency like them that go and check on their patient, and if they see that the patient need to be seen, they are wasting no time. They are calling the family and say, we're going to Dr. MENCIA. And some of the people that had been diagnosed, it was interesting because I have a patient, I said, listen, I'm going to have the visiting nurse come over and check on you. He's a young guy, 70, 74, in good shape, exercise like you,
Thank you.
Yeah, very young, very active, he's like...
going on 50?
Yeah, 74 going on 40.
40.
So...
Okay.
And I say, I'm going to send the visiting nurse. So, he say, what? Are you crazy?
She cute? No. And he say she's cute.
That was the convincing part.
Okay.
Say, I'm going to send you my best. I'll send you Miss Peggy. She's going to like her. And then he said, is she blonde? I say, yes, she is.
What are her measurements?
So...
Why did you want to send someone to him? Because you were worried about him?
Well, he already had bronchitis. And it was in the verge of becoming bronchopneumonia.
That's why.
So, as you know, the bronchiole, the bronchiole tree, it goes from the trachea, which is like the main stem of the tree, and then it's spread out into branches. And when the infection is closer to the trachea, which is the main pipe going down into the two lungs, as it spread out, the further the infection get into the branches, the worse the infection. The closer we can get to that infection, so when you have a little upper respiratory infection, it's on the upper part of the trachea and the throat and that area sinus, and that, can give you complication, but usually localized complication in the area. The sinuses give you hoarseness and what have you, difficulty swallowing. But when it gets lower and lower into those branches of the respiratory tree, the higher the chance of developing complications. So one of the complications from bronchitis, you can develop bronchopneumonia. Once you go into bronchopneumonia, because you have all the blood vessels that go there to pick up oxygen, now that infection is going to spill over into the bloodstream. Now it becomes a sepsis. So but when you become septic, a lot of times you go into a coma, you need to get intubated, you need to go into intensive care, you might need to get into a breathing machine to keep you alive. Then some people, the lung will collapse on them because the infection is so bad that it just keep growing and pass and become like an abscess, and the infection then can move into the wall of the chest and collapse the lung. or it can allow fluid to seep over into the outer part of the lung, so between the lung and the chest wall, and give you what is called a pleural effusion. And when you have a pleural effusion, then you have to have a chest tube put in, because that fluid will not come out by itself.
Wow.
Because it's infected. So it's like when you have a pimple, you need to get the pus out for the pimple to get better. When you have an abscess, you have to drain the abscess for the abscess to get better. So when you have that fluid collected between the lung and your chest wall, it's called a pleural effusion. And that effusion, we need to make an incision on your chest wall, and we need to put a tube in there, and then by what we call negative pressure, by suctioning, slowly we try to get that fluid to come out while you're getting antibiotic on the other end.
This is amazing.
So it can,
and how could we have stopped that?
By getting flu shot.
A flu shot.
Seeing your doctor early. Sometimes, and I tell you, I was talking to one of my patients yesterday. He was there seeing the orthopedic doctor, the back specialist. And he said, Dr. MENCIA, why you open on Saturday? You're doing so well Monday through Friday. Why you decided to open on Saturday? And I say, well, number one, I hate to turn people away. It's not my personality. It's not my kind of, I'm not that kind of individual. I hate to turn people away, number one. Number two, I'd rather be able to have my patient come to me that I know them versus going to an emergency room or going to a urgent care center that they don't know anything about my patient. And I get to maintain the relationship with them of dependency, that they know they can count on us, that we are there for them. And when I decided that I wanted to do it, the first thing I did, I sat down with, Diana and Juan and Luis and Vionela, and say, guys, this is something that I think we should do. We should give it a try and see how this goes. And it had been very, very successful. Very successful. Yesterday, still 4 o'clock, people were walking in. I mean, not yesterday, last Saturday. 4 o'clock, people were still walking in.
Right. Well, thinking about it, it seems like weekends people always get sick, and I don't know what that is. What is that? Is it mental? Is it, what is it?
No, it's just the way things happen. People get sick on the weekdays too. What happens is on the weekend, usually you don't have a doctor with your staff. My ultrasound technician is there, my laboratory technician is there, my administrator, Dharma, come on Sunday and see, And let me tell you a good story. Last Saturday, we had a call from 2 patients, both of them from Canada. Both of them were husband and wife, and not related to each other whatsoever. It just so happened last Saturday. 2 patients, both from Canada, both husband and wife, both were going on a cruise, and one of them was having pain and needed an extraction. And
that's right, the dentist, you told me.
So we had that dental emergency coming in, and then the second Canadian that came in is because he had a bridge, and the bridge was loose. And in reality, what happened, it was like a 3-unit bridge. The middle will have a small abscess, so we had to take the bridge off, clean the area, re-cement that bridge so he can go on his cruise. He was so grateful. He said,
he would have had a real problem on that cruise.
He was so grateful. He said,
right.
He was telling us about the Canadian system and all of that. He said, I can say one thing I learned today is that we both have positive and we both have negatives when we look at either system.
But that does. I was thinking when someone doesn't feel well and it's Thursday, and then they think, well, maybe I'll go Friday, and they're booked up. The physicians' offices are booked up, and everybody leaves, of course, like 4, maybe by 5, they're gone.
They're ready
on Friday.
To go.
They're ready to go.
Especially on payday.
Yeah, That's true. Give me my money. That's why I don't pay till 4 o'clock, 5 o'clock. They always wonder, I didn't get paid yet. I know it'll be in your slot at 5 o'clock. That's very funny. Yeah. But what happens is then they've waited too long, and they have to wait till Monday.
Exactly.
That's where the trouble comes in, right?
And
where they call you on the phone, the doctor, they'll call. It's Saturday or Sunday. Say, I don't feel well.
Right, exactly. So, when you know that you start feeling bad, you start getting sick, you see something is coming down, you feel that muscle ache and pain and what have you, a little headache. Maybe you feel the temperature, you feel shivering. When you feel the symptom, when the symptoms start coming about, invest in yourself. Just call the office. We might not be able to see you that morning or not even that day. But guess what? If you call the office and you say, listen, I am really, really coming down with something, I need to see the doctor, they'll put your name on a standby list. So if they see 1 or 2 cancellations that afternoon, they'll be calling you back and say, okay, we have a cancellation coming. Or if the patient, sometimes some of them, they know if they have certain condition like congestive heart failure and it's really advanced,
what to do over the phone.
They know that I have an open door.
Something really serious like
that.
Right.
If they come and sometimes we've been I shouldn't say that on the air. Sometimes we put them in front of other patients because we know it's urgent.
No, of course, I
understand.
But
my patient,
that.
We are like a family. They understand. They see something. They say, we see that this is a real emergency, and they wait. They're okay.
Right. and let me just say about your flu shots, which I had there. I don't even know they finished. I said, so you give me a flu shot? We did it. You did it. So it's not even painful. We're going back to the flu shot. Yeah. So I hope that everybody knows that. Let me give you a phone number to call.
954.
You love to say your own number. I think you should make up a song.
I don't even know my cell phone. So
I know you.
I only know that one.
Oh, you know this one? Okay, well, that's right. We're not giving out your cell phone. You'd be bombarded. 954-489-1345. 954-489-1345. It's called the Adult and Geriatric Medical Center, and it's located over there on East Commercial Boulevard at 1608 in Fort Lauderdale. And if you want to get on the website, they have a very interesting website, and you'll be able to see listen to a lot of Dr. Mencia's previous shows, which are also interesting. It's
very
adult.
Educational.
It is very educational. Very. Well, you learn so much. I learn so much every time I'm here. For me personally and for my friends, I always say, did you know what Dr. Mencia said today? So it's 1608 East Commercial Boulevard, Fort Lauderdale, and the website is adultgeriatrics.com. In fact, I have to laugh because when I come home, Bill will say, so what did Dr. Mencia say today? I said, you should listen to the show.
Put on your hearing aid again.
Yeah, put on the show, Bill, so I don't have to tell you that. So now I have him I have my stick, and I give it to him. Not my stick, it's my flash drive, sorry. My flash drive, and I said, just put it, listen in your computer then, and you can hear it. But your shows are really fantastic. I like something that you said when you first came in, and we do have some time. There is something called lymphedema, and if someone doesn't know what it is, why don't you explain what that is and talk about it?
When you have when we look at the circulatory system, you have the arteries that come out of your heart, the heart being the pump of blood. So the artery comes out of the heart and go throughout your body, your brain, your fingers, your toes. And when the blood gets delivered to the tissue at any point in your body, then the venous system is the one that collects the blood again and bring it back through the liver, into the lungs, through the kidneys, so that blood gets cleansed, reoxygenated, sent back to the heart, and recirculated. The other system that we have that works a lot slower than the arterial or the venous system is the lymphatic system. And just to remind people, when you have any kind of a surgery like a mastectomy or anything like that, sometimes they go on the affected breast, they will go and under the armpit take some of the lymph nodes. The reason we take the lymph node from the side of the affected breast is because those lymph nodes on the armpit, under the armpit here, are responsible for draining the blood that is in that tissue. So if you're draining blood and you have a malignancy, then that malignancy will travel to the lymph node first before it travels anywhere else. So the lymphatic system is very, very important for circulation. It's part of our circulatory system, and we don't tend to see it that way because it's a side track. That is not the main track, such as the arteries and the veins. And sometimes when we spend a lot of time either sitting down, very inactive, or if we spend a lot of time standing up, but we don't wear good support in our leg, we are more prone of developing lymphedema, which is the inflammation, like when a person gets swollen ankle. Okay? You can have swollen ankle, and it could be related to many, many things. But when you have the lymphatic system being affected, you notice that the entire leg, start swelling up on you. So your feet, your ankles, your calf muscle feel tight. So it feels like somebody has wrapped a band around your leg. You can still move your leg, but your leg feels heavier. And when you look at that leg, it is swollen, but it's not the swelling that we see from problem with your vein. When you have a venous problem, you see that your ankles are swollen, but not the rest of your leg. When you have a lymphatic system dysfunction, you see that swelling will go right along your leg. And, you heard about the elephant man.
Yes.
Yeah. Elephantiasis is the extreme, is what we see in third world country of lymphatic drainage dysfunction. It's a real problem, and when you develop elephantiasis, you have that problem with the lymphatic system coming all the way up into your abdomen, lower abdomen, and so on. So, having said all of that, I have one of my patients, very stoic lady, beautiful lady, nice, so beautiful. I sent her to a colorectal specialist, and she dressed so beautifully. She's 88. She dressed so beautifully that the colorectal specialist said, "Wow, you got all dressed up for me." She goes, "No, excuse me, I dress up like this every day."
For myself.
Yes.
That's right. She does it for herself. There's a lot in that.
And, she takes such great care of herself, and she has lymphedema. But
why? Why does she have lymphedema?
Because when she were younger, she would wear those high heels and would not wear good support for her leg. And she developed lymphedema, but she takes such great care of herself that I say, constant coming to see me when her lymphedema is, when you do the measurement, she can have 1/4 of an inch increase in the circumference of her calf. And she say, "Oops, my lymphedema is coming right back." She comes running to me. And then I get the nurse, I get the visiting nurse, they will go in there, they will massage, they will get the lymphatic system draining.
That's what I was going to ask you. That's what you do for it?
Exactly. And if you see her, you go out, for dinner with this lady, you look at her leg, she has a beautiful leg. You will never say that lady has lymphedema. But she's very aggressive in managing and preventing that from becoming any kind of a significant problem. So it's a mild problem. And sometimes when I have a new nurse or a new doctor working there, and they go, "Oh, you don't have lymphedema." She say, "Excuse me, I do have lymphedema. Mm-hmm. Don't tell me that." I know I have it, and she's aware of it. Nobody will put her head under inside the sand, because she wants to be aware of it so she can continue to fight it as long as she can, and she's doing a great job. The problem with lymphedema is that sometimes the person see that, and then they start coping and learning to live with it instead of aggressively treating it. And, the take-home message is that regardless of how advanced your lymphedema can be, we can treat it. Now, the earlier that you notice any problem with, in your extremity, and it could be the arms, although we don't see it that frequently, but I did see a patient with some lymphedema on the arms and the leg. It could be the arm, it could be one arm and both legs, it could be any combination of things. But when you see that your ring doesn't fit properly in your finger, that your shoe doesn't tie properly, then you might want to say, maybe I have some problem with my lymphatic drainage, and let me go and take and have that looked at. When it comes to the legs, what I do, I make sure in a woman that I check for, do an ultrasound of the pelvic, make sure there's no problem internally, such as ovarian either malignancy or ovarian benign tumor, or with the uterus, that you don't have a benign fibroma that is is big enough to produce pressure on the drainage system and prevent that flow from coming the way it's supposed to go. When I see the problem on the upper extremity, we do an ultrasound to make sure there's no lymphatic swollen, the lymph nodes on the axilla.
Wow.
Because it could be maybe the beginning, and that's for men and women, by the way. It could be the very beginning of a breast malignancy that we can catch very early. And I have one of my patients that came to see me, and she's 90. I want to say 92, early 90s, and she came to see me because her ring got stuck. So we all start doing home remedy in the office.
Oh, because her ring wouldn't come off.
It would not come off, and we are massaging and trying to get the swelling down and using olive oil and using this and then we go and we pull the ring out. And we took a piece of thread and put it to the ring. Whatever idea came up from the staff on how to get a ring out of the finger.
Because that's what she told she was swelling, right?
And she just came because of the ring. That was her. She didn't think about swelling. She just think, my ring got stuck.
And she comes to the doctor.
So we got the ring, and she comes to the doctor, and she say, if I go to a jewelry, they're going to break. I don't want my ring to be broken, so I want to see the doctor. So anyway, we did salvage her ring, we salvaged the finger. And he said, okay, we have to find out why you swore like that. And we investigated, and she had a small cancer on the right breast. She has a tiny cancer growing, 90-something years old. It was benign. It wasn't a malignant cancer. But what happened is at any age, your lymphatic system will take down, start draining, and it was producing a blockage already. So we went in, and I called, my good friend, Jonathan Levine. I said, Jonathan, I have this lady. He looked at me. He said, let me say 92. I said, yeah, that's right, 92. But she still walks with a walker, and I think if her arms swell up, then, she's going to end up in a wheelchair because she's going to use the walker. So, yes, I want to see if we can. I said, okay, so he saw her right away. We did the medical clearance. I got the whole process going. Before I even called the surgeon, I went ahead and I did my lab because I knew we were going to operate. If he didn't want to do it, I would get somebody else. I said, but I knew I was going to get this thing done. So I got all the blood tests. I called. I got my EKG. Got the patient ready for the medical clearance. Send the patient in. Patient came back. Patient is doing fine, and she still come to me with her walker.
Well, and her ring. And thank you, Dr. Mencia. As usual, we've run out of time, but I want everyone to know 954-489-1345 is open on Saturday. That was a very important discussion, because that, I'm sure a lot of us have swollen ankles at the end of the day. We really ought to look into that. So please do that. And thank you, Dr. Mencia.
I have, the system that we have created at the Adult and Geriatric Health Center is working so well, just to help people live with lymphedema without showing that they have lymphedema.
Yeah. I appreciate it so much. I think we probably should write something. I think it's a very good article for us to do in February. Yeah. I was going to think about something for the heart, but that's okay. Thank you very much. And we have Joe Karp, who is waiting for us. We'll just have a fast commercial. Be right back with you, Joe. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.